Thank you very much. I call Ruth Maguire to be followed by Liz Smith.
Presiding Officer, this pandemic may be the greatest challenge of our time. Lives have been lost, everyone's lives have changed. But whilst we are all in the same storm, we're most definitely not all in the same boat. Disabled people's lives are being disproportionately affected by COVID-19 and the changes put in place to deal with it. Inclusion Scotland highlight the loss of vital social care support, unequal access to healthcare, information and food, and say that on top of years of exclusion and austerity, disabled people have been dealt a triple whammy of virus, lack of control, and lack of support to enable them to endure this pandemic and whatever comes after it. They've provided a helpful statement based on their knowledge and expertise as a disabled people's organisation, which contains 5 asks of policymakers. I commend that to colleagues. There's a lot of messaging out there, understandably, about what you can do to protect the vulnerable. And it is, of course, right that we behave in a way that keeps everyone safe and is mindful of how our actions as individuals impact on our whole communities, on the whole nation. However, one of the things that Inclusion Scotland ask for is that we stop stigmatising disabled people as vulnerable and problematic. Disabled people are workers, carers, employers, board members, and we have to guard against presenting any group of people as weak and helpless. Of course, disabled people are at risk from the virus, but they're also at risk from the attitudes and irresponsible behaviour of some. And sad and difficult as it is to say, sometimes the failure of vital services to support them. If our societal structures and physical environment prevent or inhibit participation from people with disabilities or impairments, or that participation increases risk to them, it's not about the supposed deficits of those individuals, but rather about the deficits in our society, and something that we should all aim to remedy. Yes, disabled people are vulnerable to the virus, we all are, but disabled people are also active, resilient, equal citizens, many of whom have other people relying on them too. As we adjust, change and alter the measures and restrictions in place, we must remember that and make sure that our words, policies and actions reflect that too. And I would just add support to Neil Finlay's comment about experiences on the ground matching the policy intention. It's important that we are mindful of that. Another ask is that human rights of disabled people are promoted and not diminished. Hard-won human rights protections are the most vital, both most vital and most at risk in times of emergency and crisis. Inclusion Scotland state that even before the pandemic, the support services necessary for disabled people to fulfil their human rights and make full contributions to society could be lacking and inadequate. Many of the positive changes being made in response to the pandemic, such as more acceptance of remote working practices, are things which disabled people have been advocating for years. As we move forward to the so-called new normal, by taking a human rights-based approach, starting with direct involvement of disabled people, we can ensure that longer-term changes are sustained and positive. Lockdown is not a new experience for many disabled people, particularly those with certain long-term health conditions, compromised immunity, energy impairments or mental health problems. Getting things right first time round when developing policy can save unlimited problems and expense later. I echo their call that they're involved in any new policy, the design, the delivery and the practice. They're the experts in their own lives and know best what's needed to make services fit for purpose and accessible. Finally, Presiding Officer, I want to talk about communication. The need for inclusive communications has never been more important. Disabled people need both accessible information and accessible ways of communicating, regardless of their impairment. Without accessible and timely information, they may not be able to play their part in overcoming COVID-19. They might not be able to raise an issue or ask for the support that they or the people that they're caring for need. I ask that the Scottish Government and service providers across all sectors, including doctors' surgeries, food shops and chemists, ensure that all the information that they issue, either mass communication or how they communicate with individual customers or service users at the front line, is accessible. Things like opening times, public health announcements, letters and mail shots need to be readily available in formats like British Sign Language, Braille and Easy Read, and include subtitles where necessary. Frontline staff need to know how to communicate with and not just to disabled people, such as writing things down if they're wearing a mask. Presiding Officer, the Scottish Government has 7 principles for their decision-making process, and of course they will consider them all. They're all important. Number 4 is fair and ethical, upholding the principles of human dignity, autonomy, respect and equality. I'd commend that to the government as a good principle to have sandwiched at the heart of decision making, and just echo the calls from colleagues Alison Johnson and Angela Constance that this place that we're travelling to can be better. It can be fairer than the one we've left. Presiding Officer.